I'm going to go ahead and start the recording. And thank you guys for joining us on today's lunchtime webinar series that we've been hosting. Today I've got Tony Siebert, or Walter, with Prairie Band Health Center Behavioral Health, and he's going to be talking about like mental health awareness. And then after he's done, I've got Susan Brocksterman with Kickapoo Nation Health Center. She works for the CHR department, and she's going to be talking about stroke awareness and signs and symptoms. So Tony, you are up.
Okay. Can everybody hear me all right?
Yes.
Okay. All right. Anyway, like Tiffany said, my name is Tony Siebert, and I'm the manager for the Prairie Band Potawatomi Behavioral Health Program out here. I wanted to talk a little bit first about our program and our staff out here. We currently have 4 therapy providers, including myself. We have Kara Arnold. She's a behavioral health therapist out here with us. Mindy Thompson, she's primarily a substance use disorder counselor, and Mindy's probably been here the longest. I think she's worked for Prairie Band for close to 15 years now. Christine Sterrett. Christine has been here off and on for the past, I suppose 8 years or so. Christine actually was instrumental in getting me out here, and she was my boss at first when I first came out here 6 years ago. And then Christine left, went into private practice, and then we had an opening over here after I became manager, and I was fortunate enough to be able to talk her to come back to work out here. So anyway, we also have this year added a nurse practitioner to work with us, a psychiatric nurse practitioner. Her name is Karen Russell. She's been here almost a year now, but she added a large component, a very needed component to our behavioral health program. Anyway, and we also have Edie Wamigo. She is primarily our program assistant. She does a little bit of everything around here, does a lot of case management work for us. And really, we couldn't operate without her. She's invaluable to us. Charlene Zeller, she's our front desk person, and she's also a certified registered medical assistant. So she assists, splits duties between the front desk and then assisting Karen Russell, taking vital signs and things like that and checking people in when they have an appointment with Karen. So we moved into our new building here at Behavioral Health in November of 2018. This wonderful facility that we're in really, to me, speaks volumes about the commitment the tribe out here has made to the mental health well-being of the community and all Native people. And I'm very proud and honored to be able to be a part of this. Anyway, since then we have developed our program, and we're continuing to evolve and develop things as time goes on, and the staff, we can accommodate the staff. Right now, primarily we work with people with substance use disorders, or we do a lot of that. We provide evaluations for people, and then recommendations as well for people that have problems with drugs or alcohol. We provide mental health evaluations to diagnose problems, and then we evaluate what would be the best course of action in treatment for each individual. It's all individually based. We often refer people to treatment facilities. Primarily, I guess, substance use disorder treatment facilities. We use a lot of Native facilities where with people that need inpatient treatment, and we do referrals up into Nebraska and Oklahoma, sometimes even South Dakota. We've taken people up there, and then we transport the people up to the facility and then we will transport them back once they've completed. We provide individual and family and couples counseling out here. Christine is a licensed marriage and family therapist, and she's kind of the specialist in that area, but we're all trained to do some of it. So we do a wide variety of therapy. Primarily over here, we provide outpatient therapy to people, which would be individual sessions, sometimes weekly, sometimes every other week, sometimes monthly. We provide dual diagnosis treatment, and what dual diagnosis means is that and people will have a substance use disorder problem, possibly with opioids, methamphetamines, alcohol, and then also along with that, they may be suffering from depression, anxiety, sometimes psychosis, schizophrenia, bipolar disorders. They're all kind of joined together, really, a dual diagnosis. A lot of times in the mental health field, we see that people have used substances to mitigate or to help manage their mental health symptoms. And it's not a very healthy outcome usually when that happens. So we try to offer a different way of doing things for them. But we have to get the substance use disorder under control before we can really make progress on some of the other issues people may have. We offer group therapy right now, primarily for substance use disorders. We have 3 groups a week that we run. Group therapy is found to be very effective, where people can share their own stories, share insight. It really is an effective way of helping people get over or manage the symptoms of substance use disorder. We're also, before COVID struck, we had just started up a mental health group, which was going to meet once a week, and we had to cancel that, and we haven't held that group in about a year, but we do have plans in the near future to start up that group again. Several of us are trained to deal with anger management. We've had the training for anger management assessments and then treatment, and so we provide that service as well. We work really. We also provide an alcohol and drug information school. These are primarily for people that maybe have just recently gotten a DUI or some other offense like that, but it might be their first time. And that's usually the baseline where we'll start out at, required by the courts to have them go through. It's an 8-hour school that we put on once every quarter now. And we've been doing that for quite a while. We provide crisis intervention here, primarily for when their crisis arrives here on site, be it at the medical clinic. A lot of times we'll get referrals from the medical clinic that someone's in crisis over there, and we will try and tend to that. Also, we maybe get called out here during the work day on crisis issues that arise, and we work closely with the police department and as well as the courts here to help with those issues. We also our counselors we were anyway, and this will happen again, but we were going into some of the jails. Right now with COVID, they're not allowing people into the jails, but we have gone into the jails to do assessments and counseling as well, at Jackson County, Shawnee County, Brown County, even Atchison County, to serve the Native people that are there. Anyway, but we collaborate really well with law enforcement, with all the courts, and our role, we feel like, and my philosophy here too, is that we always want to be seen and viewed as an advocate for whatever patient we are seeing. And a lot of times they do have legal issues pending, things like that. But we We hold their confidentiality secure. That's a primary focus over here. What is said in here stays in here, and that means we can be an advocate and an ally for that person rather than being seen as an adversary, which usually that's the view they have of the courts and probation officers, things like that. So we try to maintain that we are uh, behind them 100%. We are there to help them make their lives better, and we are not there to get them in trouble or turn them in or anything like that. So we have some pretty stringent ethical standards that we go by over here. And if we don't do that, I'm afraid we would uh, fail at our mission here to serve this community and their mental health needs. I want to talk a little bit today about what is mental health. You know, a lot of people wonder about that, I guess. Um, well, mental health, it includes several factors. It's about a person's emotional, psychological, and social well-being. It's kind of a holistic approach. You know, our mental health can be affected by many things. It can be affected by our physical health, our spiritual health, um, our history, our culture, our family. So all of our therapists here are highly attuned to where people came from, the different cultural aspects. We have we serve 100% Native American people, but at the same time, within the Native American community, there is different cultures, and that cultures can be tribal, it can be spiritual, it can be even down to the family culture. You know, so we have to be highly attuned and aware of that because that all affects a person's mental health. Um, uh, to recover from mental health issues, it's like four dimensions. One of the things is your physical health. You know, if people are suffering physically, a lot of times their mental health suffers as well. One of the things we do when we initially see somebody is during an evaluation period, is we inquire as to when they have last seen a doctor or when they've had a checkup. You know, and had blood work done because there's various factors, diabetes, thyroid problems, things like that can really have a telling effect on a person's moods. And well, we see a lot of that with depressive symptoms with people that have maybe thyroid issues. And if we can get that under control, then we can really do some work in therapy on helping them recover as well. So we're very mindful of that. The other thing is their home or their environment where they're living at. That's another big piece of the puzzle for a person's mental health. You know, we have to meet the primary needs of a person first. If they don't have a safe place to live, if they're not getting enough food to eat, things like that, those things have to be addressed before you really can make any headway with a person's other mental health issues. So we try to coordinate and partner with other organizations that maybe for those issues like housing, food, things like that. And to be honest with you, a lot of those resources need some shoring up in this area, especially with housing, I think. So, um, and then giving a person a sense of purpose again. That's what we see a lot of with people with mental health issues. Not that they've given up, but they're just kind of don't really have a strong sense of purpose in their life, and so we try to reconnect them with that as well. And then lastly, community. It's about building relationships and social networks to provide support. You know, human beings are we're not loners. We're not meant to be. We are creatures of a herd, and we need that connection with other people to really be content in life and to have the kind of emotional stability and support that one needs. I wanted to talk a little bit about the stigma of seeking out mental health help. That's kind of been a big one with me anyway. Since I came out here, I've always been a real advocate for people to seek out mental health help when they need it, because so much so many people actually have a need for that, and they may know it or whatever, but they're afraid of the stigma that will be attached to them because they're doing that. um, Either from friends or family or the community. So we are making every effort, and I think that was part of the reason of building this building over here, having a separate facility for mental health, is to have a little more privacy, a little more confidentiality. But the more people we can get in this building, the better, I think. It's because it normalizes people seeking out mental health treatment. I tell a lot of my clients that, you know, you may get a cold and you'll go see Dr. Blake or Nola over at the medical clinic. They'll give you some medicine over there, and uh, and by golly, in the next week or two, you start feeling better. And does that mean you're never going to get another cold? Well, no, it doesn't. It's an ongoing process. I try to normalize that with mental health too. Not all of us need mental health treatment every day, but we'll go through some tough times, and we see a lot of that out here with grief issues and other things. So we'll get people, where they're feeling better, and it's all patient driven. We tell them that, we try to explore with them, when do you think you're going to feel like you won't need to come here anymore? And we kind of leave it up to them, but we always leave the door open. Anytime you need a little tune up or another issue crops up, that's what we're here for. And I think we're making some progress as far as bringing down the stigma in that area. At least ways, I hope so. And one barometer I use is of our patient load right now. We do see a lot of elders over here, and I think that stigma with people. Well, I'm an elder, I guess. I'm 66, but I mean, we're seeing people out here my age and older. I think in that era, the stigma was pretty strong. I think as generations pass through, I think it's going to be a more and more of a normal thing for people to seek out help when they need it. The one common thing I've seen with a lot of mental health issues is it's rooted in maybe secrets, something so dark in their head that they don't want to let anybody else know that this went on in their life or this happened to them. It could be a variety of things. But I always use this comparison. Those secrets, I compare it to mold. And I tell them that what does mold do when you keep it in the dark? Well, it grows and gets stronger. Okay. And then if you take that secret out and tell it to somebody, you shine a light on it. What does mold do when you put it in the sunlight? It takes the power away from it. It withers and dies. So many times it's people are carrying these tremendous burdens around with them, or these secrets. I like to call them burdens, I guess. And this is a place they can unpack those and sort things out and metabolize maybe the bad things that's happened to them or what they've seen or witnessed, that has caused maybe has been the root of a lot of their mental health issues over the years. So, and with Native American community and the culture, statistically, they have a higher rate of post-traumatic stress disorder from trauma for many reasons. And anyway, the problem is I'll just say this, the white man's world is that many times the symptoms as presented to us will be, if you were working in a clinic, say at Topeka or something, it might be diagnosed as just like a major depression, a personality disorder, something like that. But oftentimes what we really look for is the trauma factor, the PTSD, because they can display the same symptoms as some other disorders. So we really try to sift that out and get a proper diagnosis on that so we can better treat them. Let's see, going back to the stigma thing a little bit, I'll just give you some real quick statistics. It says 1 in 5 American adults experience mental health issues at some point in their life. 1 in 10 young people in this country experience major depression. And 1 in 25 Americans have lived with a serious mental illness, such as schizophrenia or bipolar disorder or major depression, and it's gone untreated. And that tends to set you on a path in life that's not very pleasant. And so the earlier we can see people, and try to get them on a good track, the better. Let's see, some other myths I think about mental health treatment is, one thing I think people think is people with mental health problems are violent and unpredictable. From my experience, the vast majority of people with mental health issues are usually the victims of violence, the victims of crime, not the perpetrators. And so I try to dispel that, to the public as well. Another myth is people with mental health needs have trouble or can't manage their own mental illness and can't tolerate holding a job. That's simply not true. If they get the proper treatment, people can function normally, at a high level, actually, too. So, this is a myth that I'd like to do away with, too, is that therapy and self-help are a waste of time. Why bother with it when you can just take a pill? That is so prevalent in our society now. People want a quick fix for everything, and they think a pill will fix their depression, will maybe fix their anxiety, or other issues like that. The real truth of the matter is that it's behavior change along with medication where you really get the good results. It's been proven by research that enacting behavior change and making that a consistent thing in your life, changing the way you do things, actually changes brain structure. Just acting in a different way. A lot of times the medication, what it does is it lets people maybe, I always liken it to like a bridge across a chasm. You want to get from point A to point B, but there's this huge gaping hole in front of you. A lot of times the medication can be like a bridge where you can cross that and at least start working on behavior change. So it's the two working together where you get the best results, not just taking a pill and all your problems are going to go away. And I think most people logically know that, but I think it's been instilled in our society. Oh, you just go get an antidepressant, you'll be fine. Well, there's other issues besides organic ones, maybe why that depression is prevalent. So these are things we try to do a lot of informational stuff with people and increase their awareness as well. Another myth is prevention doesn't work. It's impossible to prevent mental illness. Not true. Environment, culture, all of those things, we can do larger scale changes and help prevent a population with a lot of mental health needs, in my opinion. So it is about being an activist as far as legislation goes, as far as community goes, what goes on in your community, providing resources for people. It's environment plus, or the old nature versus nurture thing. It is environment has a piece of it, but it's also your own family and your culture has a piece of it as well. So it's changing a lot of those things. I will talk about medication a little bit. Since we've gotten Karen here, our new APRN, we're starting to explore medically assisted treatment as well for people with substance use disorders. In the past few years, they've came out with some really good medications to help people. Primarily, it was targeting the opioid dilemma or the opioid epidemic that was going on in this country. So they came up with some drugs that actually block the receptors that opioids work on, and then helps people break that addictive cycle with that. It's been proven to be a real help. Well, they also found out it works well a lot of times with people that have alcohol problems as well. That it will help reduce their cravings, um, and help them get a better start on getting past that addictive cycle that they're in. So we're trying to improve that piece of the puzzle out here too. One drug that I'm really excited about that we're trying to get going out here is a drug called Vivitrol, and Vivitrol is a once a month injection that you get that will help reduce those cravings for alcohol or opioids. And the good thing about it is it's a once a month injection, so a person doesn't have to take a pill every day. And a lot of our folks have a real problem with their medications, and just remembering to take them, maybe losing them for whatever reason, stay in med compliance. So that really kind of solves that puzzle. So we're working hard to implement that with people that qualify for it. There's some criteria that people have to meet. They have to meet certain health standards, before that drug can be used. But it's just another plus, to help people recover from addiction. Addiction is something that you don't cure, but you teach people how to manage it. And it's one of those things that has a stigma around it. We like to use the disease concept for addiction, which I myself believe it is. And if we use that and then educate people about, you have this disease and the bad things that you've done in your addiction, that is directly due to that drug. It's not you. Inside, you are fine. It's just we need to manage this addiction. Find a way to do that. What works for you, and then you can be who you are supposed to be, rather than an addict out there that's causing pain for the family, for themselves. And another really cruel statistic is addiction left unabated ends up in one of two places. You're either imprisoned or you die. Your odds with cancer are better than they are with active addiction. And that a lot of times, and that's true, and that opens up people's eyes a lot of times and gets them started. I think dealing with the Native American community out here, we try to apply best practice out here to with cultural sensitivity, I guess, and so we're always reading and looking what's working in other places with the Native American communities, and there's some just real basics that need to be that we need to hold by, and that is is honoring the culture that person came from. We have to be genuine in all of our dealings with people. If we're not genuine, we get nowhere. If I tell all my therapists out here, if you don't understand a certain cultural practice, be it within family, within the community, I says, inquire, be curious, ask, have them explain it. That validates people's beliefs, and that is so important. And we work real hard on respecting what people believe, and so far we've just got a great team out here. I think it's working beautifully. Anyway, but we're always open to suggestions as well. So anything we can do to improve our care, the better. I think I talked about the Native American community a lot of time being misdiagnosed. When a lot of times PTSD is kind of the underlying cause or for their problem, but it's manifested in other symptoms. So we're highly aware of that. Let's see what else we can talk about here. I think, well, I don't know what the hell I want to do. Was maybe just run over some of the base, I guess, primarily what we see out here with mental health diagnoses. ADHD, attention deficit hyperactivity disorder. That's one that you see thrown around a lot. That person's got ADHD or whatever. That's another thing that we have to sift through and figure out. If a person is using, let's say, methamphetamines or stimulants, maybe are addicted to those, they mimic the symptoms a lot of times of a bipolar disorder. But what I've found over the years, and since I've been in this field, is that people that had maybe childhood ADHD, where they had trouble focusing and concentrating, things like that, they're highly susceptible to becoming addicted to methamphetamines because that is a highly effective drug on the symptoms of ADHD. People that when they first take methamphetamine, all of a sudden they can focus, they can get things done, their life improves quite a bit. Of course, with methamphetamines, it's not too long before that takes over your life and then the whole thing turns upside down. But I have seen that a lot with people that they had a childhood diagnosis of ADHD, later on became addicted to methamphetamines. But like I said, that's why it's a dual diagnosis practice out here. If people are actively using, let's say, methamphetamines, they can look like they have the symptoms of a bipolar disorder. We have to get them clean or off of the drug for a certain period of time before we can really place an accurate diagnosis on a person to help them. So that's a challenge in itself as well. But we do see folks a lot of times with ADHD, anxiety and panic disorders. Those are one of the primary ones we work with. People coming in here with problems with that. Of course, depression, all different classifications of depression, I guess, or various degrees of depression, and we can help them with that. There's certain depressions that are kind of constant, and that takes a little bit different approach than a major depressive disorder, because there's time limits on the major depressive disorder, and so anyway, once we get that sifted out, then we can make some headway. We do see people with psychotic disorders, schizophrenia. Sometimes a bipolar disorder can manifest symptoms of psychosis as well. Also, drug use can present with psychotic symptoms. So once again, we have to sift through that and kind of figure out what's going on. There are some good drug treatments for a lot of these, and thank God now that we've got somebody in here to prescribe those. We can really help people with some drug treatments, especially for the psychosis and the bipolar disorders. A bipolar disorder takes like a mood stabilizer. Psychotic disorders take an antipsychotic medication, and then of course antidepressants will. That's pretty self-explanatory. And then there's other anxiety medications that are kind of coupled with some antidepressants that seem to work real well. So, but once again, I'll go back to this. It's about changing behavior along with some drug therapy that really you get the best results with. And a lot of people are resistant to drugs. I don't want to have to be taking that my whole life. And what I tell them is that, if you start working on this and really change your behavior, and we change some things that you're doing in your life, you may not have to take that drug for your whole life. Now, of course, I wouldn't tell that with somebody with schizophrenia, because that's simply not true. But many times people have the wrong impression about that, I guess is what I'm saying. So we try to provide a lot of education as well. I don't know. Can I open it up to any questions or?
Sure. So if anybody's got any questions, now's the time to ask.
Hello, can you hear me?
Yes, I can.
Hi, my name is Deanne DeRoyne,
Yes.
and this has been very helpful, thank you. And our Tribal Health Summit group focuses primarily on health education.
Mhm.
And I'm wondering if you have done, or if you and your staff would be available to do a session just focused on meth and the things we should look for, the approved treatments, and what we can do as family members to help our addicted family member have a successful treatment.
Yeah, absolutely. You said meth, education on methamphetamine abuse.
Right, and if people think that we would like to expand that to opioids, that would be fine too, but I'm just thinking that.
Yeah. Well, what we see, the two major addictive disorders we see out here are alcohol and methamphetamines, and I would say that it's about even, to be honest with you.
Mhm.
Yeah, so I think yeah, we would be open to that.
Oh, that would be wonderful. So we'll be in touch with you about that down the line. Thank you so much.
You're welcome. Anybody else?
Hi, this is Elizabeth Berger. This is not really a question, just a comment. I really appreciated sort of your explanation on how the role of pharmacotherapy and helping people understand it's not necessarily a lifetime sentence. It's really, I think you called it a bridge. And that was just really helpful language for me to think about when I talk to people I know that could probably benefit. So thank you.
Yeah, well, I appreciate that, but it is true. A lot of people have the wrong impression of, I think, medication, and you know, we believe here in the mental health field that people have the power to heal themselves inside them, and but what we do is we just help them, give them a space, and help them kind of guide them through that process, and so we want to empower people as much as we can, and when people feel like that the only way they can be who they're supposed to be is by taking a drug every day, well, that's not necessarily true. So we try to dispel that at every chance we get. So
Anybody else?
okay, I probably
Well,
took up
thank you,
too much
Tony.
time, huh?
Thank you. And then, so next we have Susan Broxman with Kickapoo Nation Health Center, going to talk about stroke awareness and signs and symptoms. She did say she's having some problems with her video, so we may only have audio here. So Susan? Susan, are you there? Maybe we lost her totally. Susan? I guess we're having technical difficulties today.
Tiffany, would you hear from her via text or email, or would you like me to call the clinic if she's at the clinic?
She should be at work. She emailed me a little bit ago and just said that she was having problems with.
I'd be happy.
Yeah, problems with her camera. So, yeah, I don't know. It shows that she's still on there. Susan? Oh, she said, I'm here.
Oh, good, okay.
Yeah, I wondered, did she have her mic turned up or issues with the mic? Sometimes that happens. I love the way that we're all these random black boxes trying to troubleshoot.
Right.
You're doing an awesome job, Tiffany.
Well, thank you.
Really.
So she says she's unmuted, and I do show that she's unmuted.
Wow.
This happened on a call I was on last week, and that individual just logged out and then logged back in again, and it worked, but I don't know why it did, but I guess that's an option.
Okay, Susan, if you want to log back out and then log in. Okay, so it looks like she logged out and she'll be coming back in. So maybe she'll be able to start then.
It's a shot in the dark, literally, but it did actually work last week.
Well, fingers crossed that it works like that today too. Oh, there she is. And she muted. You have to unmute again, Susan. Okay, Susan, can you talk now? I think we may just be having technical difficulties.
Yeah.
So we can save Susan for another day, maybe next month when we do our, we'll be doing Men's Health in June. And I do have a couple of speakers for that, so I'll be getting a flyer out. And then that would be good too for, to do Men's Health, and then we could still do the stroke awareness.
Great.
So we'll just, we can
That
do
sounds like
that.
a great idea.
Yes.
Yeah.
Thank you, Tiffany.
No problem. So with that being said, I'm gonna start my video. Turn this around. And here is the drawings for the 2 gift cards. The first one is Christina Simmons. Yay. I will email you. And the next one is Karen Molinax. So thank you guys for joining us. And like I said, next month is going to be Men's Health. And then we'll do the stroke awareness with Susan. And then after that, I'll have one in July, which will be just kind of a lead into the Tribal Health Summit, which we will host in August. So since we started planning that, go ahead and look for information. We should hopefully start sending that out soon. Dr. DeRoy, do you have anything you would like to add?
Yes, I would just like to encourage everybody to tell your friends. And if they have any ideas about how we get the word out about our Lunch and Learns, we would appreciate it.
Okay. Okay, well, thank you guys very much and hope to see you guys next month.
Thank you very much.
Mhm.